It's actually an interesting way of doing a self-assessment for organizations to really think deeply about how they're really doing on 4 different domains of things that are important to patient safety. The first domain is culture, leadership, and governance. The second one is patient and family engagement. The third is workforce safety and well-being. And the fourth is learning systems. So each one of those domains was carefully constructed actually by a group of organizations of national prominence across, so IHI was part of that, as well as AHRQ, the Agency for Healthcare Research and Quality, and many others, as well as people like me in the field who are in the real place doing the real thing. The way that the NAP assessment works is it's basically at the organizational level, and one of our recommendations that we followed was to have people that should know, meaning people that are in executive levels, people that are involved in quality, physicians chairing teams, et cetera, take this assessment. And basically when you take it, each of the domains is made up of elements. So for example, an element in learning systems and culture, leadership, and governance is safety goals. So at a level 1, the way, if you read the description, it says, well, we have some safety goals, but they're not really that specific, or they don't have action plans, or they're not called out anywhere that you would be able to find them, all the way to a level 4, which is they're clearly articulated. They're in your strategic and operating plans. They are understood by the organization. You have measures, you have action plans, and by the way, they reflect national issues as well as local. So you're allowed to sort of assess yourself honestly. So the comments were really valuable, the qualitative. This is not research. This is asking people for their perception of how we're doing on this element around here. So that's how it works. And then when you get the results back, you're able to then understand what you're doing well. You're able to understand where you have a disparity of thought. So people rate us a 0 to a 4, and and it really supports then a conversation about why is that, what's going on around here, and then creating a prioritized action plan for improvement.